Hi, I'm attorney Casey Walker. I'm the founder of VA Disability Group. I'm a former VA adjudicator, and I'm an attorney. Let's talk today about mental health diagnoses and symptoms for VA purposes. What do they look like? Let's start with the most important thing. You need a diagnosis. Does the VA instruct adjudicators or provide any insight as to what constitutes a diagnosis? Well, it does actually. Let's take a look at it. We're going to look at 38 CFR 4.125. There it instructs the adjudicator in subsection A, if the diagnosis of a mental disorder does not conform to DSM-5 or is not supported by the findings on the examination report, the rating agency shall return the report to the examiner to substantiate the diagnosis. The takeaway there really is that the DSM-5, we have a separate video on it. It's in our description below, so you can apprise yourself as to what that is. But it's a book for medical providers of diagnosis for mental health practitioners. And a diagnosis needs to come from there. So if you have a mental health condition, we'll call it in-law syndrome. That's not a real condition. It needs to be in the DSM. Maybe it needs to be, but it needs to be in the DSM. And if you don't see it in the DSM, then it's not a valid diagnosis for VA adjudicative purposes. Now, what you'll see over time is certain conditions get added every decade or so. You have new conditions. Take, for example, PTSD. In the 70s, that wasn't a recognized diagnosis. And so you have some unique gray area where you have a diagnosis, but in a previous adjudication, it might not have been in the DSM. But for all intents and purposes, you need a diagnosis from the DSM, the Diagnostic Statistics Manual. If it's a current diagnosis, it needs to be in the current version of the DSM, which is currently the DSM-5. Now, I'm going to expound on this in a little bit, but when you're getting a diagnosis, try to avoid personality disorder diagnosis. I'll expound on that in a little bit. Another consideration for veterans when they're filing a mental health claim is a warning against seeking multiple diagnosis. So let's read directly from the regulation. If you look at subparagraph B in 38 CFR 4.125, it says there, if the diagnosis of a mental disorder is changed, the rating agency shall determine whether the new diagnosis represents progression of the prior diagnosis, correction of an error in the prior diagnosis, or development of a new and separate condition. So that last section there, or development of a new and separate condition, can really be harmful to veterans. So take the following example. A veteran's already service-connected for PTSD, and the veteran wants to get, let's say, an increase for that PTSD, and the examiner diagnoses them with major depressive disorder. Well, now we have a new diagnosis we've never seen in the record. The veteran's not service-connected with major depressive disorder. When you have this situation, the examiner needs to delineate the symptoms between major depressive disorder and PTSD. Now, there's a box where they can check where they can say they can't delineate the symptoms. And that's what most examiners will check because there's so much overlap between these mental health conditions. But on occasion, you'll get an examiner who'll say they can delineate the symptoms. And they'll try to lump a lot of the symptoms to the non-service connected condition, knowing it'll have a punitive effect against the veteran. We always instruct or advise veterans to try to stay consistent with diagnosis. And if you have a new diagnosis, maybe it's incorrect. So if you think it's incorrect, you probably shouldn't even submit that to the VA. You want to avoid multiple diagnoses because it can be used and weaponized against you. So let's say you're diagnosed with PTSD and you have a new provider and they change a diagnosis to major depressive disorder. When you're in this circumstance, what we usually instruct our veterans to do and what we'll usually pursue is we'll seek a second and third opinion from a mental health provider and trying to confirm the original PTSD diagnosis, because that's what you're going to want to do. You want to stay the course with whatever already service connected. So if you have a new diagnosis, seek a second and third opinion, or maybe go back to the original treating professional, and they usually stick with their diagnosis. So you see this most often when you have a change of healthcare providers and the new provider wants to be in the driver's seat and give their diagnosis. So if you can, try to go back to the previous provider or seek a second and third opinion and make sure they know about the original PTSD diagnosis or whatever the mental health condition is that you're already service connected with, seeking a continuation of such a diagnosis. So now that we've discussed the diagnosis and warnings against multiple diagnoses, let's get into the actual symptoms. And this is kind of where you start getting into the show me the money. Symptoms equal percentages, which equal money. compensation percentages. So the VA instructs adjudicators to consider the frequency, severity, duration, remissions, and adjustment capacity. Let's take a look at 38 CFR 4.126. Now, if you look at subparagraph A, we're going to read it together. When evaluating a mental disorder, the rating agency shall consider the frequency, severity, and duration of psychiatric symptoms, the length of remissions, and the veteran's capacity for adjustment during periods of such remission. So what's that getting at there? Well, you need to throw the adjudicator a bone, and you need to give them symptom logs, treatment records, sworn statements, maybe buddy statements, maybe your neighbor can provide a statement. If you have something happening in the employment or your workforce, maybe some type of punitive action or a reprimand because you're having outbursts in the workplace, or maybe you're using the restroom too much because you're seeking solitude. Those are all examples demonstrating the severity and frequency and all these other things. So you got to give them that. You can't just assume that an examiner is going to assume you have these symptoms persistently. You need to show them, help yourself, and give them the evidence. So the most critical aspect of rating mental health symptoms is social and occupational impairment. Yet again, we see this in 38 CFR 4.126. If you look at subparagraph A, the second sentence, it says, the rating agency shall assign an evaluation based on all the evidence of record that bears on, and here we go, occupational and social impairment, rather than solely on the examiner's assessment of the level of disability at the moment of the examination. They're saying it can't be a fleeting examination report that's relied on, and they're also saying that these symptoms need to somehow affect your social and occupational abilities. Let's hash that out. What are social abilities? Well, maybe friendships, maybe maintaining relationships with neighbors, maintaining relationships in the workplace. Maybe it's seeing your family, going to family reunions, all the things that people do, that humans do, because we're social. If you find yourself limited or not desiring to do those things, you might be limited because of a mental health condition. So when you're describing the symptoms that you have, it should segue to, I'm depressed, and I ended up not going to my family reunion this year. So you're getting to the social aspect. Or I don't go out with my wife anymore. We're on the cusp of a divorce. I snap at my kids. I don't go to their sporting events. They think I don't support them anymore. Well, now again, you're providing the and how it affects you. So my depression is severe, and it affects me in a social way. So that's the social. But you also have this occupational aspect, so social and occupational impairment. My anger issues are affecting me on the phones in the workplace. Maybe you're on a phone team and you're snapping at these people calling in and they just want an update on something. And maybe you're getting reprimanded for such. That would be occupational impairment. Maybe you're profoundly depressed and you can't even get out of bed and you have to call in sick. Send the VA proof of maybe an email you sent to your boss saying you need to take a sick day. And it would help your case if you say, I am struggling to get out of bed, I'm really depressed today, therefore I can't come into work today. That type of evidence can really be probative because it shows a judge or an adjudicator that you're not just saying this, here's proof, I'm struggling. So get to the occupational impairment. For example, we had a client one time who literally went to the bathroom in the workplace about every 30 minutes, and they would spend 10 minutes in the bathroom because they were so riddled with anxiety, they couldn't even sit in the workplace. And they like the comfort of being within the walls of a restroom stall. And that would be occupational impairment. And these are just a few examples. And what you'll notice, we're going to dig into the rating schedule in a second, is that there's not an exhaustive list of symptoms. Symptoms are unique to the individual. So what we're going to look at is they give examples of symptoms, and we'll cover that. But the important thing, though, is that everything you're describing to a medical professional who's providing an examination report somehow touches on social and occupational impairment. Before we actually dive into the rating schedule, I want to point out that intellectual disabilities and personality disorders are forbidden by the VA to be compensated for VA disability purposes. So let's take a look at 38 CFR 4.127, which covers this exact topic. I'm going to read directly from the regulation. There it states intellectual disability, and it parenthetically states intellectual development disorder, and then it continues, and personality disorders are not diseases or injuries for compensation purposes. So personality disorder specifically is the most common thing we see. You cannot seek compensation for a personality disorder. What constitutes a personality disorder? Well, some of the ones that we see, examples might be borderline personality disorder or antisocial personality disorder, that's not adequate for VA disability purposes. So if you have a personality disorder diagnosis, you're going to want to go to a second and third provider, a mental health provider, and you're going to want to get a diagnosis that is within the DSM-4 that does not fall under the personality disorder realm. If you have a personality disorder diagnosed, make sure you don't have an underlying mental health condition that they have failed to diagnose. You don't want to submit that to the VA. It will hurt your case. It will hurt your case potentially significantly because they might try to attribute every single symptom you have to a personality disorder. We saw this routinely in the 1970s and the 1980s. You don't see personality disorders diagnosed to the same frequency we once did. Now there's also a lot more mental health providers, and they make their living off of giving diagnoses that are in the DSM, and psychiatrists can treat with medication, some of these mental health medications. So sometimes money actually drives a diagnosis too. But as long as you know, avoid the personality disorder diagnosis, it will help your VA claim. Okay, so we've discussed some basic premises that you need to be aware of when filing for mental health or seeking a certain disability rating. Now let's look at the actual rating schedule. What is the rating schedule? It gets into the symptoms and what percentages should be assigned for certain symptoms. And as you're probably aware, those percentages equal a dollar amount for monthly payments when you're receiving disability compensation. All mental health conditions are rated under the same criteria. So if you have major mood disorder, major depressive disorder, PTSD, dementia, all symptoms for mental health, anything that falls under the DSM-5, will be evaluated under the same criteria. So make sure you're aware of that. Now let's look at that criteria. And this is found at 38 CFR 4.130. Again, this is commonly referred to as a rating schedule. Let's start with the criteria that's found at the 100% range. It's important to note as we dig into this that just because you have something in the 100%, 70%, 50%, and 30%, they got to look at the total picture here. The adjudicators are instructed to look at the totality of symptoms. So you might have a little overlap. Some symptoms found in 70%, some found in the 100%. That's normal. We're looking at the big picture here. And another consideration is this is not an exhaustive list. These are by example only. So you'll notice in the very first sentence found in the 100% criteria, it says total occupational and social impairment due to such symptoms as. That word, such symptoms as, isn't exhaustive. It isn't inclusive, meaning that if you have other symptoms, that's okay. This is just giving examples. So let's take a look at the examples. Now, the thing I want to bring your attention to is the very first word we see, total. Again, total. That's important because total social impairment, that's pretty strong. Total occupational impairment. There's none of this part-time work. There's no wiggle room here. You can't work. You don't have any really ability socially. It's total. So it's not a forgiving evaluation. It really assumes that you are essentially stuck in a home and incapable of working in any fashion. It's a hard standard. Oftentimes, individual unemployability is an easier route to pursue 100% disability evaluation if you have a mental health condition, because the total occupational and social impairment presupposes very extreme symptoms. Now, we have a different video on potential changes that may happen in the next year or two to the mental health rating criteria. The focus of this discussion is the law today in 2025. If the law changes tomorrow, we can reconvene on that. So the 100% criteria, you're looking at usually, again, extreme symptoms. You're looking at delusions. You're looking at extreme paranoia, people who just don't bathe themselves. Think extreme. Now let's take a look at the 70% criteria. You'll notice it doesn't include the word total. Instead, it says occupational and social impairment with deficiencies in most areas, and then it says such as. But deficiencies in most areas is the critical part here. Not all, it's not total, it's most areas. So what do they mean by most areas? Well, they're trying to categorize things like, your work, your home life, family relationships, your church relationships, your moods, and then they start providing specific examples such as, and they get into suicidal ideation, obsessive rituals or obsessional rituals. And I gave the example earlier of an employee, someone we representing, going to the bathroom over and over and over again. That would be an obsessional ritual. Useless speech and communications. Maybe you're tangential. Maybe you're just talking and it's really not relevant to anything that you're discussing. Maybe you have near continuous panic and depression that limits your autonomy. What does that look like when you're limited and in your autonomy to be independent? Maybe you're forgetting to take your medication. Maybe you're refusing to answer the doorbell. Maybe you're not eating or bathing. But those are the types of things that they're getting at when they're getting to the independence, your ability to be independent or at home by yourself. Maybe you have an impaired impulse control, that you just snap at people, or maybe you get road rage while you're driving routinely. If you're getting road rage a few times a week, that's probably gonna fit within this impaired impulse control. Personal appearance and hygiene. You know, some people don't like to shave every day, but this is getting to more than just that. This is like you're not washing your clothes, you're not brushing your teeth, you're not doing anything with your hair. Maybe you just have given up on any appearance whatsoever. Not just appearance, there's a degree of mental health that's healthy when you don't want to come across as too slobby. Well, at least that's what the VA says. And so that's what they're getting at there for the personal appearance and hygiene neglect. Another one is difficulty adapting to stressful circumstances. Well, what does that look like? Maybe you started a new job and you're just breaking down. Maybe you're a cop and you're encountering stressful circumstances daily by going into homes with potential criminals and you're having breakdowns. You're not sleeping. You're crying yourself to sleep. You're going and admitting yourself into hospitals. You have a difficulty adapting to new circumstances or stressful circumstances. Another one would be an inability to establish and maintain effective relationships. Effective relationships, what's that mean? Just any relationship. Effective meaning probably non-criminal, but you can't maintain your marriage. You can't maintain a relationship with your children. You can't maintain a relationship in the workforce where you have to communicate with teams that you're maybe working on a project with. Those are all examples in the 70% range, okay? Lastly, let's look at the 50% range. You'll notice there, the key words is occupational and social impairment with reduced reliability and productivity due to such symptoms as, and this is where we get into what are the types of symptoms. It's not exclusive. They have flattened affect. What's that mean? Maybe like a lack of an emotional response to stimulation or to any type of prompting. Maybe you're just stoic. Well, I mean, think really stoic. That's kind of what flattened affect is getting into. Circumstantial. They get into different types of speech here. So they describe circumstantial, circumlocutory, and stereotype speech. So circumstantial, think tangential. You're just kind of rambling. You're not really getting to the point. You're just rambling, speaking about irrelevant things. Circumlocutory would be too many words to describe something. So think of every attorney you've ever met. That would really fall under the circumlocutory. You know, a lot of attorneys do these things, so it's kind of funny. Lastly, stereotype speech might be repeating the same thing. Maybe you're using synonyms and you just keep repeating the same thing. Maybe you're using different words, but you're essentially saying the same thing. Like the powerful, strong, and mighty, those are all saying the same thing. You get the idea. So stereotype speech. Another one is going to be panic attacks. So panic attacks, sometimes people lose the ability to breathe properly, at least they think they have. They start hyperventilating. They gasp for breath. They feel like they have air hunger, panic attacks. Memory is another one at the 50% range. Maybe you're so strung up or depressed or hyper aroused, maybe it affects your memory. Let me segue on this memory bit for a second. When you go into an examination, this is where a lot of veterans get in trouble. They embellish on the memory part. The examiner might say, I'm going to tell you 3 words, try to remember them. And then at the end of the examination, they'll say, do you remember any of those words? Usually someone can recall at least one of them. So if you can, don't lie. Tell them the word. Another example would be, can you remember who the previous president was? It's a bad look if you're a highly functioning professional and you can't tell them who the previous president was. You lose credibility. So don't be a buffoon. Be honest when they're asking about memory-related things. If you have a genuine memory issue, it'll manifest itself. Another consideration under the 50% criteria would be impaired judgment. So think of people who have excessive gambling problems. Maybe they drive too slow on the highway or in town. Maybe they drive too fast. I had a client one time who got a ticket for driving too slow. That's a true story. Maybe when you send an email in the workplace, instead of just sending it to a few people who it needs to be addressed to, maybe you send it to the entire workforce or directorate. Maybe you work for the federal government, you send it to the whole agency because you have the ability to do that. That would be impaired judgment, or those are some examples of impaired judgment. And then lastly, Lastly, under the 50% range, it talks about difficulty in establishing, maintaining effective work and social relationships. Now, compare and contrast this to the 70%, where you need to have an inability to establish and maintain effective relationships. So we're stepping down from the 70% stringent criteria. It's not an inability. Rather, in this 50% criteria, it's difficulty. So if you are divorced 5 or 6 times, it might lend itself to people perceiving you having an inability to maintain a relationship with a spouse. But if maybe you're legally separated or something, maybe that's a difficulty. And maybe that's a bad example because we're talking divorce and people get divorced for good reasons all the time. But maybe in the workplace, you have to put on a new team and a new team and a new team because you're having difficulty maintaining relationships in the workplace. The examples are potentially endless here, but that's what they're getting at. It's not an inability, it's just difficulty. And it's a different standard than the 70% criteria. All right, so we discussed a lot here. Mental health is quite encompassing. So let's cover some of my final thoughts and some of the high points that you need to be aware of. Symptoms fluctuate. That's why it's important to document with symptom logs, treatment records, buddy statements, and statements that are similar to buddy statements, call them sworn statements, but you need to document the consistent nature of your mental health, because mental health, these symptoms really do fluctuate. People have highs and lows with severe mental health conditions. If you met someone on a good day with a profound mental health symptom, you might not know that they have severe symptoms. Well, the examiner is no exception. They might not realize the severity of your symptoms if you haven't given them documentation of such. Because symptoms fluctuate, it's paramount that veterans give the VA a history demonstrating the severity of their symptoms for mental health. Avoid multiple diagnoses. I can't emphasize that enough. If you have the ability, try to avoid multiple mental health diagnoses. If you get a new mental health diagnosis, never file for another disability for a second mental health condition. The VA only allows for a compensation of one mental health condition. Veterans hurt themselves routinely doing this. You can only be compensated for one mental health condition. Because of that, it's in your best interest to have one diagnosis. Avoid personality disorders. You cannot be compensated for personality disorders. So borderline personality disorder, there's different ones, but if you have a personality disorder diagnosed, it's not going to do you any good. Social and occupational impairment, everything comes back to that. So when you're describing your symptoms, ensure that you're hitting the high points as to how those symptoms affect your social and occupational well-being. If you have a mental health condition and you're calling in sick routinely or whatever these things might be, you need to get to that, because that's what the adjudicator is at least held to examine. Social and occupational impairment. The last thing we didn't talk a lot about, but if you have delusions, hallucinations, suicidal or homicidal ideation, or a really scattered employment history, those are things you definitely want to bring to the examiner's attention. You want to draw their attention to that, because those things compensate well. They usually are in the 70 and 100% range. If you're seeing or hearing voices, there's auditory hallucinations, there's visual hallucinations. You need to tell the examiner. If you get it documented, make sure you give that documentation to the VA. If you have suicidal or homicidal ideation, this is killing of oneself or another person, doesn't mean you're going to carry out that act, but if you have fleeting thoughts of it, it's probably best to communicate that and seek the adequate care that will hopefully mitigate those symptoms. But you need to draw the examiner's attention to those fleeting thoughts or active thoughts, because it can compensate better. And then lastly, I mentioned the employment history. If you've had several jobs, bring some type of proof demonstrating those jobs. Maybe you can show some of your pay stubs from like the 5 jobs you've had in the last year or two. And that's showing an inability to maintain employment or to maintain relationships, but it shows the severity of your mental health symptoms, or at least it can. So there you have it. Those are my final thoughts. Those are the high points. I hope you found this helpful. This was a long discussion covering some of the basic premises that you need to be aware of when filing for VA disability compensation for mental health conditions. Thanks for watching. I hope you found this helpful. If you did, like and subscribe to the channel. Have a good day.